What are the major challenges for women with bleeding disorders?
Well, indeed, there was a major opportunity today at this meeting of the World Federation of Hemophilia to address some current issues regarding women and bleeding diseases. Well, I address more specifically some challenges for women who are carriers of hemophilia. Well, clearly there is always a major focus on male, but we should not forget that for every patient with hemophilia there are several women. Some of them are carriers, obligate carriers, potential carriers, and I think we need to be more proactive. Many of these carriers have never been identified, they've never been informed. We do not know whether they have clotting factor deficiency. Some of them have never had genetic testing to clearly demonstrate that they are carriers. So major efforts are needed here for the future. Let's not forget that carriers do represent the future of hemophilia. So during my presentation I try to emphasize this. These are major challenges. So care of the hemophilia carriers should be part of the comprehensive hemophilia care for the future. I think this is important. And also I emphasize the fact that at each clinic we should review the pedigree, the family tree, and make sure that all the carriers have been identified, informed. This is important, especially before they consider a pregnancy. It would not be safe to consider a pregnancy when you are a carrier without good counseling before. These are important messages.
What would be the risk for a woman who is not aware of being a carrier of a bleeding disorder?
Well, what would be the risk? Well, the risk is to discover during the pregnancy that she is a carrier, and she wouldn't have major options at that time. So we want to prevent or avoid this kind of dramatic situation. Every woman should be before the pregnancy, and what the options are. Because we have several options. What does she want to do in terms of her prenatal diagnosis or diagnosis during the pregnancy? Is she ready to interrupt the pregnancy, yes or not? And we need to discuss this very openly, but we can only do that if from the beginning of the pregnancy it was really established that she was yes or not a carrier. And during the pregnancy they have to be followed, especially at the end of the pregnancy. We need to review this lady, check their factor levels, and also make sure that we have a good plan for the delivery. We should agree in advance what should be done for the delivery.
Which type of delivery would you recommend?
Sometimes difficult question. First of all, the delivery should take place in a hospital where they know what hemophilia means, where they have the local expertise. Everyone should have this information and then decide. In some cases we would prefer cesarean section if we feel that the delivery could be complicated, if the obstetrician prefers that, if the lady prefers this. In other scenarios, vaginal delivery could be a safe option. But clearly after the delivery we should take care not only of the baby but also of the mothers, and make sure that the mother do not get delayed bleeding complications after the delivery. These are important challenges for us.